By show of hands, who among us or who knows someone they care about who is diagnosed with diabetes mellitus? I myself has a family history of diabetes. Living with diabetes is not easy. There are several complications that a diabetic person may have during the course of the disease. One of its most common and most serious complications is diabetic foot ulcers. According to the researches by the World Health Organization and American Diabetes Association, diabetes or DFQs are the leading cause of non-traumatic lower extremities amputations. About 50% of these patients who have amputations due to diabetic foot infection die within 5 years. Diabetes causes more amputations than landmines in former war zones. Yes, it is that scary. Good evening. My name is Dan Annam. I've been a wound nurse for 3 years now, and today I will talk about diabetic foot ulcers. I'm not going to talk about this topic in full details because that will require us a few more hours in order for us to cover everything. Rather, I will give you a concise overview of what diabetic foot ulcer is and its interventions. First, I will explain what diabetic foot ulcer is and its characteristics. And then I will discuss how it is developed in a person with diabetes. And lastly, I will share some information on how to properly manage diabetic foot ulcers. In order to understand what diabetic foot ulcer is, we will start with its definition and characteristics. Dr. David H. Seconds from Advantage Wound Care describes DFU as a wound involving the foot in a person with diabetes, originating in a chronic or acute injury to the soft tissues of the foot with evidence of neuropathy or ischemia or both. There are several distinguishing characteristics or appearances of diabetic foot ulcers. First, DFU usually appears as a full-thickness deep wound that may or may not have devitalized or necrotic tissues to the wound bed. It also presents with moderate to heavy drainage that could cause maceration to the wound edges if it's not properly taken care of. And lastly, DFU usually has a well-defined shape and callous wound edges. Let's take a look at an example of a diabetic foot ulcer. As you can see, this wound is a full-thickness deep wound. It's showing some granulation tissue and some devitalized tissue or slough. It has a well-defined shape and it has callous wound edges. There are several factors that could lead to the development of diabetic foot ulcers. First is neuropathy. Neuropathy or nerve damage due to the uncontrolled high blood glucose levels represents the major cause of DFUs. It includes sensory neuropathy, motor neuropathy, or autonomic neuropathy. Sensory neuropathy means loss of sensation to the foot, which inhibits the person to feel painful stimuli to the foot, and that could lead to skin damage or injury, including diabetic foot ulcers. Motor neuropathy, that could lead to deformity that creates abnormal bony prominences or pressure points that gradually develops into a skin damage or including diabetic foot ulcers. And autonomic neuropathy, that could lead to the decrease or absence of sweating. That could lead to a very dry skin, and that very dry skin could lead to the formation of calluses or skin fissures or wounds. Next is ischemia. Ischemia or poor blood circulation due to the hardening and occlusion of arterial walls in the lower extremity due to the chronic high blood glucose levels could lead to compromised skin integrity or even tissue death. With either neuropathy or ischemia or both, an initiating factor, mechanical or physical stress, is essential in the development of an ulcer. In short, there should be some kind of a trauma to the skin for an ulcer to develop. Now I have talked about what a diabetic foot ulcer is, or its characteristics and how it is developed. Now I'm gonna share some information on how to properly manage diabetic foot ulcers. First is disease management. Of course, we're not just gonna take care of the wound. We're gonna take care of the patient as a whole. We're gonna address the whole disease process, and that includes maintaining vital signs, especially blood glucose levels, and that blood glucose levels, if they're within normal limits, that optimizes wound healing. Also, adequate hydration and nutrition, including supplements, would greatly aid in your wound healing. Routine wound assessment, properly done by a trained professional, is essential to monitor the progress of your wound. Proper debridement or the removal of your calluses and devitalized tissue or necrotic tissue is essential to facilitate the granulation tissue or healing tissues to form. And of course, routine wound care, that includes your topical medication applied to the wound or the dressing changes as ordered by the physician. Offloading or relieving the pressure of the affected wound or affected foot will facilitate better blood flow or better perfusion to that area to minimize the risk of amputation. Amputation includes elevation of the limb, avoiding ill-fitting footwear, and wearing or using footwear modifications such as cam boots or controlled ankle movement boots. Surgical interventions are usually the last resort, but it could also be an option if deemed necessary by the physician. Surgical interventions are done to correct bony deformities if prior offloading measures are not effective. Surgical revascularization is also done to the ischemic limbs to facilitate better blood perfusion or better blood flow to minimize the risk of amputation. And lastly, prevention and management of infection will not only help you in your wound healing, but also minimizes your risk of amputation and patient mortality or patient death. In summary, diabetes mellitus is a serious disease that could lead to a series of complications that could lead to diabetic foot ulcers. And diabetic foot ulcers, or DFU, if not properly managed, could result into limb amputation and even patient mortality or patient death. However, these complications are avoidable if properly taken care of, and appropriate intervention measures are rendered timely and effectively. Do you have any questions?
No, I don't think so. That was good.
Thank you for having me. Have a good night.
You too.